Alex Merks. I'm the Director of Marketing and Partnerships at Cognitant. So thanks a lot for attending the session. I have the pleasure today to introduce you to Dr. Emma Vaux, who is consultant nephrologist and general physician at the Royal Berkshire NHS Foundation Trust, where she's clinical lead of the Berkshire Kidney Unit. She's also clinical director of integrated medicine and medical associate director for patient safety. Emma has been previously Vice President of the Royal College of Physicians for Education and Training and Chief Examiner. She's also led on the development of the RCP 500 Code of Conduct, is a Health Foundation Generation Q Fellow and founding member of the Q community. It goes on. And she's also co-editor of ABC Quality Improvement in Healthcare, an associate editor of the Future Healthcare Journal. So knowing all of that, I don't think any of you are going to be surprised that in 2021, Emma was awarded an OBE for services to medical education. So we at Cognitant have had a real pleasure to work with Emma and the renal team at the Royal Berks to develop an innovative educational program to help people with chronic kidney disease better understand and manage their conditions. So thank you so much, Emma, on a very, very busy day with ambulance strikes going on to add to the mix, to take the time to talk us through your experience of developing this program with us and your experience of using it with your patients. Thank you.
So thank you very much. It's a great pleasure to be here. So without going into a mutual love-in, it's a great pleasure to work with Cognitant as well. And I think that that's hopefully will come shining through about where you can have these really productive partnership working to make a difference. So just a little bit of background to begin with, just in case you're not quite sure what on earth we're talking about with chronic kidney disease. So CKD is its abbreviation. There are around 3.5 million people who have chronic kidney disease in the UK. And chronic kidney disease means that your kidneys don't work very well. They don't work as they should. The kidneys can't remove the waste products from your body. And there's quite a wide range of conditions that can cause that, the most common being diabetes and hypertension. So, and the word chronic, won't surprise you, means that it's a long-term condition. And it can vary from being very mild to very severe. And it's clinically important because it causes a lot of cardiovascular problems. And it can also make you much more susceptible to acute kidney injury. And that's where the kidneys suddenly stop working. And that often occurs at a time when someone is unwell for another reason. And it's important because it's a forced multiplier. So what it can mean is that you'll become even more unwell. It occurs in about 10 to 20% of hospital admissions. And it also means that it's associated with very poor outcomes, including death. So having severe chronic kidney disease as well causes your increased risk of hospital admissions and death. So it's not really sounding that great so far. But the other aspect of this is that about 2% of those with chronic kidney disease also progress to what we call end-stage kidney disease. So that's where you might need dialysis treatment or, if possible, a kidney transplant. And so in the UK, there's about 67,000 people on renal replacement therapy, and about 500,000 people a year will get acute kidney injury. So it's a sizable problem. And having end-stage renal failure reduces your quality of life. It's a difficult condition to live with, and it's also extremely costly. So the cost of chronic kidney disease 10 years ago was around 1.5 billion. Which is equal to 1.3% of all NHS spending. So, and more than half of that sum is spent on those 67,000 who are on renal replacement therapy. And then not least, this increased risk of strokes and heart attacks, that it's estimated there are around 7,000 excess strokes and 12,000 excess heart attacks that occur a year, with in patients with chronic kidney disease, and the cost of that is 175 million. So we're kind of building a picture that it's not a great thing to have, not great for the long term, but also it's very costly. So anything that we can do to help support people with chronic kidney disease, to really try and prevent them from progressing onto needing renal replacement therapy, and also how we can reduce the impact of what that means for them, and not least then the whole experience of having chronic kidney disease is so important. So it is such an important problem, and then not least it's a growing problem. So it's estimated by 2030 there will be 4 million people with chronic kidney disease. And we also know that it's a diagnosis that's missed. So about 1.3% of people with chronic kidney disease we don't know about in England and Wales. So that's about 700,000 people. So it's really important if we can identify, if we can manage patients with chronic kidney disease in better ways, enable them to understand much more about their condition, what does it mean, then we can have a real focus on how we can improve their self-management and what that can mean in the long run. So there's so much to play for. So back in 2017, we embarked on transformation of our outpatient services across Berkshire West. How could we have a much more patient-centred, flexible, responsive service for those patients with chronic kidney disease? We worked across the whole of the community, primary care, pharmacy, and of course, really importantly, with our patients and with other teams to look through the lens of financial, environmental, and social impacts. And this was a case study at the Royal College of Physicians. And we went live, very fortunately, in autumn 2019. So we were really well positioned to go fully live as the pandemic hit, which meant our waiting times and our reviews of patients continued seamlessly throughout the pandemic. But the important bit here is through this process, we identified the need and the opportunity. There was a critical gap in how we were building the capability for how people with chronic kidney disease could understand and self-manage their condition beyond the usual patient-written leaflet. So for people with chronic kidney disease, it's just so important that we're able to motivate them to self-manage their condition. And to do that, you need to be able to understand what does it mean about the risk of progression? What does it mean about if I do take my medication? How will that impact in the long run? And so that bit about education, we know it's so critical to self-management to improve health outcomes. And then ultimately, that's always with the intention about how we're much more judicious with our healthcare resources and cost. But we do have limited capacity within our healthcare teams as much as we want to. It's just really hard to communicate all the stuff that we want to in that outpatient consultation. The other bit is that despite what I might think is an amazing consultation, patients will only remember 40 to 80% of what has been said. They just don't retain it. And in an era of patient empowerment, and really thinking about shared decision-making in healthcare decisions, those takeaway information leaflets that we've always been very proud of don't actually necessarily provide the information in the way that patients want or need. And a lot of people struggle with that written information. We have to remember the health literacy age. So really everything should be geared towards the reading age of 11. And if we really are thinking hard about health inequality and inequity, then language barriers get in the way. Around 10% of the population in England will do not have English as their second language, and a further on top of that will not really understand English, even though they have been trying hard to learn. So that language barrier can really, really get in the way. And everything where you've got worsening health literacy, language barriers, the outcomes with chronic kidney disease get worse. So what this told us, we really, really need to do something about this. So we had a vision that we wanted to help patients better understand, manage their health, and how could we reach out to really improve their health outcomes, such as avoidable complications and disease progression. So we were really keen to explore this and looking at the ways that we could really help in terms of virtual clinics, limited consultation time, health literacies, and language barriers. And so we clearly produced a very convincing argument and plan for this. And the Health Foundation, and with the key community, funded as we set off to look at this. And then very generously, a huge investment from our renal charities at the Royal Berkshire Hospital. And that's very dear to me, is that these are very generous donations from patients and families, and that what we're doing is investing it in work that will really help even more patients at a population level. So we got together as a clinical team, and that's not just secondary care nephrologists, it's really important around GPs, our pharmacists, dietitian, and really importantly, patients and patient leaders. And this was really to understand what is it that we want and is needed to be produced, and how could we really create something that was easy to understand, was accessible, was interactive, that would complement written information, but was also a really immersive experience, that it was animated, very visual, and that people could interact it in a way that felt quite personalised. So the Healthy Note, the digital version was accessed through the Healthy Note platform as an app via a QR code, or became web-based as well via a hyperlink for patients to watch on their smartphone. So this is the avatar-led educational resource that we developed. What was so important was for this to be accessible. And for us, we have 4 other languages, our top 4 languages other than English: Nepali, Urdu, Punjabi, and Polish. And so it was really important. This wasn't just about creating this program and sticking in subtitles in the relevant language. This was about really going back to culturally appropriate avatars, really paying attention, for example, to the diet recommendations, that these were appropriate for that cultural group. And so what we wanted to do was that this resource needed to be accessible. So again, as I said, through the Healthy Note platform, through a QR code, or through the web link. But it's getting it there. It was easy for us in secondary care. You can hand something out to your patients, but how do you reach those within primary care? And there are all sorts of smart ways of doing that, but certainly texting out has been really helpful. And working with community pharmacists now, it's where are all these different contact points that patients with long-term conditions have. So if you have diabetes or heart failure or hypertension, you're much more likely to have chronic kidney disease too. So how can we use those multiple contact points to reach patients? So this will take patients through their diagnosis, the staging, and how to look after themselves. They can view it anytime, anywhere, and it can be shared with friends and families. And I'm just going to give you a flavour of it now. No, I'm going to go, be patient. So, the one thing with all of this that I would say that it's not all plain sailing. So I do lots of quality improvement work within the NHS, and lots of people want to do an app. You know, that's always the answer to everything, but it's not always the answer to everything, and I think we have to be really careful about that. Having the bit where it's on an app but also web-based has proven really important about accessibility, and also about how you can share links easily in text rather than through QR codes. Not to be forgotten, the cost. The cost can be eye-watering, I would have to say. So the bit about investment and how you work really mindfully with partners to co-create and develop, and to notice where are the connections with other long-term conditions. There's a real synergy in what we can do there. And for me, it's that you don't want lots of itty-bitty apps. You don't want an app, a program for chronic kidney disease, and then one for diabetes, and then one for their vascular disease. How do we provide that virtual hug of support and education around patients that they feel it's really wrapped around them? And then it's not to forget that you've got the setup and development costs, and you set off on your new shiny adventure. But there are the on costs, and I think a lot of people forget about that. How do you sustain the resource once you've developed it? Patient engagement is so critical. Never start anything unless you started with the patients right at the beginning. It also makes everything much more magical. And then scaling up, how do you get to reach the people that you want to? And that's, in the ever-changing NHS landscape, that's proven quite tricky. But we're getting perhaps more into the rhythm of how we can do that. And trust is really important. Certainly, fingers have been burnt within my own organisation where a company has gone into administration, and then what happens to all the intellectual property. So the important bit here then is also the impact. The so what? You can develop something new and shiny, but does it make the difference that you intended it to? So we did evaluate the use of this programme, so that versus the sort of traditional way of written information. And so we ran the pilot for a year in 2 formats, with written and with the immersive, interactive avatar-led programme. And what we found was that results showed that patients found the digital information easier to understand. They also found it easier to navigate, and they also felt it increased their knowledge. So that was really important, that, okay, we do seem to be doing the right thing. And that really set the scene about how we could improve access and accessibility. And that's when we then set off in terms of looking at what we could do with different languages. And coming back again and again, how important that has, how that's been made possible by our renal charities. So the programme has been really well received, and it's now being extended across not just Berkshire West, but across the ICS. We're looking to see how we can extend that also through Patient Knows Best, which is our new software programmes that partners for all kidney units. But in fact, the patients we really, really want to reach are those that are out in primary care. And we're also now have ventured into acute kidney injury. You may remember from the start of the talk how important acute kidney injury is. 500,000 people per year, 10 to 20% of hospital admissions, outcomes are poor. So education in that area is hugely important. And we're due to go live, hopefully, within the next month. And I think the important thing is learning about impact doesn't stop. So how can we really maximise our learning, but also maximise the impact? So we're very fortunate to have further funding from the Health Foundation and working with the University of Reading to look at that further. Do we really, really know what are all the barriers, or what makes people want to engage and look at this? What makes it work? What doesn't? How can we perhaps overcome that and develop it further? So again, very much involving stakeholders and patients in that work. So hopefully what you've seen here is about how we have given a lot of thought to what are the needs and what do patients want, to be able to self-manage their condition, learn more about their condition, understand their condition, so they can be very much part of the shared decision-making. And that when you do develop something, involving patients in the design and really looking at what's the impact of what you're doing, does it do what you intended to do, is really critical. And it never just stops, as I'm sure lots of you are involved in this sort of work, where it's forever learning. You're forever learning to see how you can make it even better, but also how to sustain it, and how do you reach the people that you really want to. So thank you very much.
At the back, thank you. Say your name, where you're from, that'd be great. Thanks.
Just a quick one. How many patients do you think have actually engaged or landed on the website?
So we capture that through the reports about engaging. So in November, there were over 200, and they're spending at least, so remember that we're going across currently just Berkshire West. And in Berkshire West, there are about 14,000 people who are coded within their GP practice with chronic kidney disease, about the same equivalent number who aren't coded, who we think have chronic kidney disease. So 200 last month, and on average they're spending 9 to 10 minutes in the site, which is actually quite exciting. And we know that from the pilot. On average, it was 11 minutes. So they are engaging with the content when they get there. But one of the bits is that constant bit about how do you get it to the people that you really want to reach. But what we do know, for example, one patient who can't read interacted with the site, and he is now going to evening classes because this really captured his imagination about what's possible. So those sort of the stories are things that keep you going, actually.
Thank you. Any more questions?
So Emma, I believe that part of the NHS long-term plan is a commitment or a pledge to try and enable 30% of outpatients to be managed remotely. Do you think that this is achievable?
So certainly with us, I know it's achievable. About 60% of our appointments are remote, but they're very flexible and responsive. So you can have remote virtual clinics, you can have remote telephone clinics, and then the face-to-face. And so what we have a remote nurse team and a physician associate who works across secondary care and primary care. And so it's a little team that will enable patients to be managed in the best way for them. So I think it's never just a target number. It's important to understand what does that target mean. And for us, it's been that flexible, responsive service. Through COVID pandemic, it was pretty much 99%. And that works to a certain extent. But actually, do you know, it's lovely seeing people face to face. And I also think patients like to be seen face-to-face when they want or need to.
Thank you.
All right, any last questions before we wrap up? Oh, we do, one at the back. Perfect. What's your name and where are you from?
Hi, I'm Mamoon from, I co-founded a company called MedAI in Cambridge, and we work in a similar space. I was wondering, it's very wonderful that you're trying to reach out to patient, even in the primary care, you're trying that. But would you share some experience? What's the ideal length of a content a patient might actually stay engaged? Is 11 minutes, I mean, we know that our engagement spans are actually reducing gradually. People don't want to watch anything more than a minute, 2 minutes, 3 minutes. 11 minutes, you mentioned that on an average, but would you expect that people will stay on, or would we need to actually compact the content in a much shorter space?
So I'm not sure I can completely answer that question. I think the intention for the content is that you can come and go, so that you might want to dip in and out, you might want to show others. And part of our reporting bit is how sophisticated we can be for the returners and for, you know, you might visit one bit of the site and then maybe you're going to go and watch the World Cup and then you're coming back and looking and your grandmother's there and you want to show the content. So I think the intention is people can use it in different ways. What the optimum is, I don't know. I would agree with you. Attention span is quite low. I think if it can capture and draw you in and you get a sense that you can navigate your way as you wish, it's not all there, and perhaps not quite so stale as just looking at a patient leaflet. But for some people, the written information is important. So it's not that you get rid of that. It's about that you have patients are able to experience different models of education in the way that they wish or want to. And everybody is different.